Everybody. We really appreciate you taking the time to join us today. This is an exciting time as we continue to launch iConnect and ultimately electronic visit verification for our providers. We started with a pilot group a couple of weeks ago, and we primarily focused on our solo providers. So today's group is primarily comprised of agency providers, although we do have some solo providers as well. Just as a reminder, and I know you heard this when you went through the iConnect week training, we have a requirement for a federal mandate with the Centers for Medicare and Medicaid Services that all providers of what they refer to as personal care services, for the purposes of our waiver, that would be personal supports and respite providers that are rendering those services in unlicensed settings must be using an electronic visit verification prior to the end of this year, so prior to December 31st, 2020. Knowing that we had that requirement, we did decide to start off with a couple of pilot groups first, just to identify where there might be some areas of special emphasis that we need to make. As I indicated, we did start with a pilot group a couple of weeks ago. We've already learned some lessons from those pilot group members, one of which is the initial part of getting your user logged on and a password so that you can get access to iConnect. So in today's training, we actually extended the period of time to 2 hours to give adequate time for us to go through all the information and also to be able to hopefully answer questions that you have going forward. So again, we appreciate very much your time that you're giving us this afternoon. We hope that you will find it helpful. And so we're just excited to continue on with our launch. So Sheila, I'll turn it back over to you.
Thanks, Lynn. And we'll go ahead and we'll get started. Just to kind of level set to get us started, wanted to do a little bit of housekeeping. Everybody is muted, so you're not going to be able to unmute your microphone. And so if you have any questions, there should be a Q&A box that's in your GoToWebinar dashboard that launched on your computer when you joined the webinar. So look for that. There's two of us that are monitoring the questions, so we will take your questions as we can. And again, if we don't get to them during the presentation, we'll try to catch them all at the end. The other thing that I really wanted to stress is that today is for information purposes only. There's no certificate, there's no in-service credits. Really what our goal is today is to kind of give you an orientation of what's expected of you during this pilot period so that one, you're getting the best experience possible, and two, we're getting the feedback that we need so that we can just further enhance everything and prepare for rolling this out to all of our other providers. So with that, let's go ahead and get started. As Lynn mentioned, you are all part of our second pilot group. Our first pilot group, as she said, started about 2 weeks ago, and we have had really good feedback from them, some things that we've changed in preparation for your experience. So I'll be very curious to hear how it goes for you. We've created some additional training materials and things like that to just further fine tune the information that's been provided, because I recognize that for those of you, I mean, you're our respite providers, which means you were in the first round of training. So your training probably feels like it was a million years ago. So that's the other reason that we wanted to get together today and give you this kind of orientation and bring you back to some of that information that you learned in your 5-day training sessions. And again, what this will do is it will pave our way for the future groups of providers that we will be bringing into APD iConnect. Absolutely, I want to stress that we want your feedback. And I'll be providing you the contact information later on in the PowerPoint, but we want to know what's working for you, what's not working for you. If you get stuck, we're going to help you through those things, because again, this is going to help us better prepare for bringing in larger groups of providers. And as Lynn already mentioned, you guys are agency providers, most of you. I know we've got a couple of solo providers, but most of you are agency providers. And so that brings an extra step that you're going to need to go through in the beginning in terms of getting access for your employees. And that's one of the things that we're going to talk about today. We are going to review the ID pass process for requesting access for your employees to APD iConnect. And again, I know you all went through the training with your region. You've seen the video that we showed on the first day. But again, because that was many months ago, we're going to show it again just as a refresher. Also, I think, Lynn, did you send out the attachments in advance?
I did. I sent them out just a little bit ago.
Excellent. So you all also have 3 attachments. One is the handouts for this PowerPoint that I'm displaying right now. The other is the handout for ID Pass that goes along with that video that we're going to see. And then the third one is how to add a service log. So we wanted to make sure that you had those documents right from the get-go so that you have them when you're ready to get started. And then the other things we're going to talk about today are what are the things that you should do while you're in APD iConnect? Because what we're doing during this pilot period is we're focusing on the functionalities that are not electronic visit verification or EVV related. We're getting you ready for EVV implementation. But before we do that, we want you to get comfortable navigating around the application itself and helping your employees feel comfortable navigating around the application. And then, of course, we're going to give you the information to be able to send us your feedback. But first, I wanted to start with dispelling this myth because I know that this is something that a lot of providers have been concerned about. Going live in APD iConnect does not mean that we're changing how you're doing your billing. So remember this slide. I put the moving GIF here just to make sure you would remember this slide. You are going to continue to bill via the FMIS portal the way you have. We are not making any changes to how you submit your claims for billing in 2020. So all I want you guys to do is focus on the things that we're going to talk about today and how to complete those steps and not worry about what does that mean for billing, because that's further down the road. Today and over the next couple of weeks, it's just how to get comfortable with the application. And to do that, we've provided you with some additional materials, and I want to make sure that everyone is aware of how to use your resources. I know that when you went through your training, you were given some materials by your trainers. We've also placed that information in our APD iConnect e-learning library. And as I said, thanks to the first pilot group, we've actually added some information to the e-learning library. So all of these items right here are new e-learning videos that we have developed in response to that first pilot group. So we're hoping that that will help you. And one of the ones that you're going to want to really focus on is assigning the EVV workers. Now, I'm going to demonstrate that for you today, but this video there will also help you when it's time for you to actually go through those steps. And then we also have a video for adding the service logs to the consumer records, which goes along with this document here, which is one of the attachments that Lynn already sent to you. So we've tried to really build up some of the information that is available to you in advance. And again, we thank our first pilot group for that because it's made our library much more robust. Speaking of the library, let me just go ahead and pop over there real quick. And so this is what the main library looks like. If you've not been here, I just want to show you some of the areas that you can check. Our main APD iConnect page, if you scroll down, because I know we have a lot of information at the top, a couple of things I wanted to point out. One is that we have the minimum system requirements document. So if you haven't downloaded it before, please come and click on this and download it. 2, we've got the iConnect support desk phone number, which we're going to give to you all over the place, so you will have that. But if you scroll further down, what I really wanted to focus on is when you're looking for updates to the implementation schedule, we're keeping all of this information updated as we make changes to the schedule, as we make updates to the schedule, we're coming back here and updating this. So I wanted to make sure you knew where the implementation schedule was. Two, wanted to demonstrate that we have also an FAQ page, and we have recently redesigned our FAQ page to make it relevant for our user groups. So for you as providers, you can certainly click on the providers FAQs, and it will take you to a page with FAQs that are just specific for providers. And as you see, we've got a page for support coordinators, for our staff. You're welcome to click on any of these, but we wanted to give you a place to start for the questions that are most relevant to you. So again, if you've got a question, check here first, because if you've thought about it, chances are somebody else has already asked that question, and you can see we have lots of answers here for you already. So again, I just wanted to point that out, that that's one of the resources that's available to you. And then, as I mentioned in the slide, we have our providers library. So again, we've broken the two libraries down into what's relevant for providers, what's relevant for support coordinators. I'm sure the support coordinators are going to be checking in to see what's available to you. So feel free to check into their library to see what they have. But we are keeping all of the information as up to date as possible. If we're doing any video presentations, we're loading them here as well. So this is one of your biggest tools for you to be able to use as you go through getting comfortable with APD iConnect. So let me switch back over to the PowerPoint. All right, and your ID pass registration, we're going to take a few minutes and talk about that. And so all of you who are part of this pilot group, you will be receiving an email later today, probably almost as soon as this webinar is over. And that email will include your instructions to initiate identity proofing and complete the ID pass registration. Once you've completed the ID pass registration, then you'll be able to get access to APD iConnect. And you'll also be able to request access for your employees. So I want to take a few minutes and talk about the email that you're going to get, because this seems to be a sticking point for some folks. It was for our support coordinators. It was for the first pilot group. You have to be on the lookout for this email. It will come with exactly this heading right here of, follow these instructions to complete your registration. That's what you're looking for. And it will have the link for you to click to start that process. This email expires in 5 days. So you really want to be on the lookout for this email to make sure that you follow these steps and you can get walked through, you can go through all of the steps to get access to APD iConnect, and then also be able to request access for your employees. Before we talk more about that, though, I'm going to go ahead, and again, I know you guys have seen it before, but it's been several months. So we're going to show you that ID Pass, that multi-factor authentication and ID Pass video that you saw on day one in your training. So I'm going to go ahead and start that. And if you have questions that come up while we're going through the video, you can type them in. We're going to let the video run in its entirety, and then we'll come back. And if there's any questions specific to that, we'll answer those questions at that time. This video will provide agency owners and solo providers with information needed to prepare for accessing APD iConnect. We will discuss multi-factor authentication and why it is needed. You will learn what you as agency owners or solo providers will need to do to be able to access APD iConnect when it rolls out to you. We will review the roles and permissions within the APD iConnect application. We will also review how agency owners will request user access accounts for their employees. And finally, You will learn what to do if you or an employee should lose your password and need to reset it. APD has adopted multi-factor authentication to access internet-facing APD systems such as APD iConnect because APD iConnect contains HIPAA-protected information. It is important that all providers understand that accessing APD iConnect is giving you and your employees, if you're an agency, access to sensitive confidential data. The MedWaiver Services Agreement binds providers to comply with HIPAA and all applicable regulations provided in Chapters 45 and 42 of the Code of Federal Regulations. It is your responsibility to ensure that access to APD iConnect is granted only to those people who need to have access in order to do their job. Providers who inappropriately grant APD iConnect access or fail to terminate access when a person's employment ends is in violation of HIPAA. This could potentially result in termination of the MedWaiver Services Agreement, and legal actions could be taken by the Department of Health and Human Services Office for Civil Rights or the state's attorney's office. So how does multi-factor authentication work? In a traditional computer system, you typically only need to have a username and a password in order to log in. Your username is who you claim to be, and your password is evidence that you are who you say you are. But the password is really only one piece of evidence. With multi-factor authentication, APD requires more than one piece of evidence. The first piece of evidence can be your password because it's something that you know. But the second piece of evidence has to be something that you have. It will either be your cell phone or a landline phone, a place where you're able to either receive SMS text messages with a one-time passcode or receive a voice phone call and then enter a PIN in on the keypad. Or you could use the mobile authenticator app on your smartphone. Once you provide that second piece of evidence, you'll be able to get logged in. As APD prepares to roll APD iConnect out to providers, certain information will be needed from you to complete identity proofing. That will include your first and last name, your personal residential address, your date of birth, a unique email address, and by unique, what that means is that it is not shared with anyone else, and a telephone number. This is required to ensure APD does not grant access to APD iConnect to anyone other than waiver support coordinators and agency or solo providers of iBudget waiver services who have a valid MedWaiver Services Agreement. This information will not be shared with any other users. It is used with APD's third-party partner for the sole purpose of identity verification before creating an account with the ID Proofing Admin Security or ID Pass system. An ID Pass account is required for all agency and solo providers in order to be able to access APD iConnect. As we draw close to rolling APD iConnect out to providers, each provider will be emailed the instructions for how to complete identity proofing. You are encouraged to keep monitoring the provider advisories that are posted on our website and listed here with the link. Also, please note, sometimes those emails get sent to your spam or your blocked folders. So when you see the provider advisory indicating that we are going to start emailing those instructions, start monitoring those other mailboxes on a regular basis. Since APD works with a third-party partner for identity verification, it is important that agency and solo providers understand that the first step to getting access for APD iConnect is completing the identity proofing process. You will want to look for an email from the APD Online Application User Account Service. It will come from a noreply@apdcares.org email. Within that email, there will be a link, and that link will have an expiration date. So you want to make sure, again, that you're monitoring your spam or your blocked folders so that you can get that email before the expiration date. Simply follow the instructions in the email to create your APD iConnect account. Also, once the notification goes out that we are sending the emails, if you don't receive an email, please contact the APD iConnect support desk at 1-800-353-5168. Once you've completed your identity verification, agency owners and solo providers will be provided with a username by the ID Pass system. Users will be able to choose their own password during that registration process with ID Pass. You will start by accessing the apd.direct user management portal at this link here on the slide, apddirect.my.centrify.com. Enter your username that's been given to you by the ID Pass system and click Next, and then enter the password chosen when you set up your user account with ID Pass. This is what you will see when you go to that apd.direct user management portal to start the login process. After entering your username and password, select your choice for your second authentication factor and click Next. You will receive that second separate authentication request via the option that you chose. Keep in mind that when you completed your ID Pass registration, you already have registered at least one phone number. And this slide is an example of what you might see after you've entered your password. You'll see here that there are the text message and the two phone options. And again, this is something that you set up during your ID Pass registration process. You also can choose to enroll your personal smartphone if you want to use the mobile authenticator app. A smartphone can use the mobile authenticator app even when that phone number is not entered in your profile in the ID Pass system. It is important, though, that your smartphone have fingerprint or face recognition enabled on it. Otherwise, the mobile authenticator app won't work. For information regarding setting up fingerprint or face recognition, please see the Access to Internet-Facing APD Systems document that's located in the APD iConnect e-learning library. These are the links for either the Apple App Store or the Google Play Store to download the iDaptive Mobile Authenticator app. These links can also be found in the Access to Internet-Facing APD Systems document that is posted in the APD iConnect e-learning library. After you've installed the iDaptive app on your personal phone, simply return to the user management portal at apd.direct and click on the Devices tab. From there, you'll be able to see an Add Devices button on the left side of the page. Here you can see at the top, and number 1 is the Devices tab, and number 2 is the Add Device button. After you've hit that Add Device button, go back to the iDaptive app on your phone and touch that QR code icon in the bottom left corner of the app screen. Then you aim your phone's camera at the QR code on the user management portal, and your phone will automatically begin the enrollment process. After that, you simply just follow the instructions that your app provides. And here's just a visual of what I just said. You can see with number 1, that's the QR code in the bottom left-hand corner of the iDaptive app on your phone. And then number 2 is the same QR code on the Add Devices screen in the user management portal. After you've set up your ID Pass account and then registered your smartphone, now you're ready to log into APD iConnect. You will always start by accessing that apd.direct user management portal, and then you will enter your username and password and choose your second authentication factor. Any phone numbers that you registered during the ID Pass registration process or any device that you've enrolled to use the iDaptive app, that will determine what you will see on the authentication method screen after you've entered your username and password. This is an example of all of the options. If you've chosen to use the mobile authenticator, you'll receive a login request through the iDaptive app, and then you just follow the instructions and touch that Approve on the login request under the notification screen within the app itself. And if you don't see that login request, in the upper right-hand corner on the app, there's a bell for an alert, and you just click on that and it'll take you to the notification screen. If you've chosen text message, then you'll receive an SMS text message containing a code and a link, and you can either take that code and enter it in to the system's login form, or you can simply click on the link and it will open your smartphone's web browser and you can approve the login request from there. If you chose phone as your authentication method, you'll receive an authentication phone call, and when you're prompted, you'll use the keypad on your phone to enter the PIN that you set up when you completed your ID Pass registration. It's very important that if at any time you receive an authentication request via any method, phone, SMS text, or the mobile authenticator app, and you're not logging into an APD system, it could mean someone is trying to log in as you. So you want to deny that request and then report it immediately to the APD Information Security Team at security@apdcares.org. Once you've completed multi-factor authentication, you will then be directed to the User Management Portal. The APD Applications icon will take you to APD iConnect, and the ID Pass icon will allow agency owners to use the ID Pass system to manage employee user accounts. Inside the APD Applications portal, you will see icons for any applications that you're authorized to access, such as APD iConnect. Clicking on the icon will open the application in a new window. You will not have to log in again because you've already logged in through the portal. Since APD iConnect is a statewide database of both consumer and provider information, there are security measures in place that limit a user's access. It's done by the roles and permissions that are set up within APD iConnect. When your ID Pass registration is completed, based upon a person's job, they might be assigned a role or multiple roles, and each of those roles have specific permissions for what that user can see. Providers will have access to a maximum of 5 roles, and we'll go and talk about what each one of those roles do and what they can access. The service provider role is the primary role that is given to agency owners and solo providers. It will grant access to your agency provider record, and it should really be limited to only you and designated staff that you authorize in writing to act on your behalf. Here are some examples of what the service provider role can see and access in APD iConnect. As an agency owner, you will want to be careful about who you give the service provider role to. Think in terms of who you would allow to have that level of access in your business today. This is a role that will also be able to see and submit claims for your agency, see your authorizations. So again, you want to think about who do I already give that level of access to. Some large agencies who operate in multiple locations may want to designate a representative from each region to have that role. Ultimately, as an agency owner, though, it is your decision to decide who should have this role. This is an example of what you will see when you log into APD iConnect with the service provider role. You'll get more in-depth information about what each of these tabs do within your provider record, but just wanted to have you take a look at this. So again, you can think about some of the information that the role is able to access and who do you really want to give that level of permission to. The service provider admin QA role also gives access to your provider record, but not all of it, just portions of it. It was designed with the administrative support person in mind, that person who may assist you with agency management. So some of the information they can view only and not edit, whereas there's other information that they can actually add or edit new information. Agency owners may wish to use this role instead of the service provider role for staff who help with administrative work. For example, this role can submit a facility application for renewal for licensed homes that are operated by the agency, or work with the region through the MedWaiver Services renewal process. This role also has access to view authorizations and submit claims. So again, think about who you would give this level of access to in your physical office and files today. The service provider worker role was designed for employees of an agency who need access to a consumer's record to deliver services and enter documentation. This role can't see your agency record at all. They don't have access to authorizations or claims. but it is the role that you will want to give to employees who will deliver electronic visit verification or EVV services, such as respite, personal supports, and nursing services provided in a non-licensed setting. You will learn more about electronic visit verification in subsequent training, but the provider EVV manager role is designed for the person who will assign workers to access consumers via the EVV mobile site, and that role will also review the documentation submitted by those EVV workers. This person will also submit claims for EVV delivered services. So they do have access to consumer records for whom you have an authorization, but it's limited access. They also have very limited access to your agency record in terms of what they're able to do. The billing agent role is designed specifically for people who all they do is submit claims on your behalf. This can be a third-party billing agent or an employee hired specifically for that role. It gives them access to everything that they need to do to be able to submit claims. There is no access to the consumer record. They are able to see your demographics in your agency record, and it have some limited access to notes to be able to communicate back and forth with you. So now that you have a basic understanding of the different roles and permission that are available within APD iConnect, you will be able to use the ID Pass system to request access for your employees. And again, this is just for agency owners because solo providers won't have employees. When requesting access for an employee, you will also define which role or roles you want your employees to have. The other thing that you'll do when requesting access is you'll determine whether or not that employee needs access to the APD iConnect application, the EVV mobile site, or both. Agency owners are reminded that when requesting access for an employee, they are indicating that the person needs to have access to sensitive HIPAA information to do their job. Once you're logged into the ID Pass system, you can use the menu to request new accounts. It's just a few screens that you'll provide some basic information about your employee. And remember, because this is your employee, you are saying, I know this person and I have this person's information. And so you'll go through step by step, and in a moment I'll demonstrate how to do this. But it's simple information like name, date of birth, email, and telephone number, much like you provide or will provide before you're able to set up your ID Pass account. You will also need to provide the employee's residential address. And again, I'll say this more than once, it has to be that person's residential address because it is involved with the identity verification process. On the role screen, you will select the role for both the main APD iConnect application and the APD iConnect EVV mobile site. Only employees who will be working directly with consumers who deliver EVV services like respite will need to have access to the EVV mobile site. Conversely, if an employee will only deliver an EVV service, they will not need access to the APD iConnect application because they can do all of their work in the EVV mobile site on their smartphone, laptop, or tablet. So again, on this screen, you're going to determine whether or not they should have access to APD iConnect or have access to the APD iConnect EVV mobile site, and then within there, which role they should have if they do have access. And then once you've reviewed the information and submitted the request, you'll be able to see that that person now appears on the account request list. So from that, let's go ahead and take a break from the PowerPoint, and I will take you into the ID Pass test site and give you just a quick demo and a tour. So here we are in our ID Pass test site. And if I didn't mention it before, ID Pass stands for Identity Proofing Administrative Security System. Once you have gone through your identity proofing and completed your ID Pass registration, as an agency owner or solo provider, this is what you will see when you log in. This is the home screen. And as you can see, there's just a few navigation options on the menu on the side. and you're able to click on account holders and see who is currently an account holder, meaning somebody that you have already gone through the process of getting enrolled through your agency's Identity Pass account. Or you can use the account requests to see how many account requests you have pending and what the status is. So you're able to see for some of them, the link has been sent, some of them are active, some are deactivated, some have been submitted, but no action's been taken yet. So you're able to see where they are in the process. Because what will happen is once you have done the request for a new employee, for example, they will get an email very much like you do that will walk them through the identity proofing steps. And as you will see when you get your email, there will be an expiration date. So if you see that someone hasn't completed their enrollment process, then you might want to get in touch with them and say, hey, Jane Doe, I see that you haven't finished doing your identity proofing and you're not an active employee in my account yet. You need to take care of that. So that's one of the things that you'll be able to manage from here. And then if you need to add a new employee, let's just say we've hired somebody, we're going to go ahead and request access for them. So let's go ahead and add Maria. Esperanza, and you have to add the date of birth. And again, because this is someone that is known to you, you are vouching for this information for them. So you are saying that you know this person, Maria, and you know that her date of birth is May 27th, 1964. You also will need to provide a unique email address for each person that you request an account for. It can be a business address, a business email address, but it cannot be a shared email address. So it has to be unique to Maria. So let's go ahead and put in Maria's email address. And you have to type it twice just to be sure. And then a phone number. Click Next. The next screen is the residential address. And again, it's important that it is Maria's personal residential address. This is information that'll be used by the identity proofing service, so it has to be everything about the employee, not your business address or any other address that might be affiliated with your business. It has to be Maria's personal email address. And then you click Next. And you get to the role screen. And again, this is where you're going to determine what access you want Maria to have. Maria could have access to the full APD iConnect application, where she is able to, depending upon which role you might give her. So again, we've got these three roles here. I know in the PowerPoint we talked about the service provider admin QA role and the billing agent role. Again, this is our test site, so it's not fully configured. But if you wanted Maria to have access to the site itself, the full APD iConnect site, then you would go ahead and choose one of these roles here. If Maria is not going to have access to the APD iConnect site itself, then you're going to go ahead and say no access. And that's exactly the case that we're doing for Maria. You've hired Maria as a respite worker. She will be delivering EVV services only. She will only ever be assigned to work with consumers and work with them in their homes. So we're going to just give her the service provider worker role, which is the role that she will use when she accesses the EVV mobile site. And then you click Next, review all of the information, make sure that it's correct, and then Submit. You get a confirmation that your submission was received, and then you could either from here, if there were other folks you wanted to add, you could add them, but you're also then able to go back to the account request, and you're able to see that Maria is right here and that the link has been sent to her to start that process. So Maria is well on her way. Now, also, we know that in the type of work that we do, that sometimes there's a change of employees. Employees come, employees go. Some folks might decide that they don't want to work for you, or maybe you're hiring someone and you've gone through the process of requesting an account for them, but they never start. So at that point, you actually do want to deactivate the request for them. And it's as simple as clicking on and clicking on the checkbox by their name, and then hitting the activate, deactivate button, which will ask you, are you sure you want to deactivate this request? And you can say, okay. And so now you can see that Jane has been deactivated. If there was an employee that left your agency, so that would be someone who is an account holder, then what you would want to do is click on their name. I'm sorry, you want to go to the account holder screen. And from here, you would click on their name and then click the deactivate account. And I'm not going to do that because I need these two examples in here for training purposes. But it's important to recognize that what you want to do, because you as the agency owner are responsible for protecting the HIPAA sensitive data that is kept within APD iConnect. So if someone leaves your agency, you want to make sure that one of the first things you do is come into here and deactivate their account, because what that will do, the next time they were to try to log in through the apd.direct login screen, they wouldn't be able to do that. But if you forget to do that, then you might have a former employee who has no legal reason to have access to any sensitive consumer data. They would still have access. So it is imperative that you do this step immediately upon termination or separation with an employee. And that is a quick tour of our ID Pass system. More information is available on our website, and in your training, your trainer can take some of your questions, and that is all. Thank you. So I've mentioned a couple of times in this presentation that APD iConnect houses sensitive, confidential information. So when you think about it, password resets are kind of a big deal because the person that receives the reset, they take over the account access, whether they're the legitimate owner of the account or not. APD has put rules in place to prevent unauthorized takeover of user access. It's going to involve 2 authentication factors, and you can't use texts as one of those authentication factors. So you have 2 choices for your password reset authentication. Either you can enter your PIN in 2 separate voice authentication phone calls. So what that means is you have 2 different phone numbers and you've got to be by both of those phones, and you will get a voice call on each one of those numbers and you'll enter your PIN. The other option is to use a combination of the mobile authenticator app and a phone call. So you would receive a request on the Adaptive Authenticator app using your fingerprint or face recognition, and you would also receive a voice authentication phone call and have to enter your PIN. To start the process, you will go to the APD Access Control Portal login screen where you normally enter your username, and you'll go ahead and click Next, just like you always do. And when you get to the password screen, you'll see that there is a link for Forgot Password, and you click on that link to begin the process. And this is just a screenshot of that password screen, and you see right above where you enter your password is that little blue link for Forgot Password. Once you click on that link, you will be asked 2 times to choose an authentication method, either phone or the mobile authenticator app. Choose your authentication method and then follow the instructions. And again, remember, you have to do this 2 times before you're even prompted to enter a new password. Okay, and again, I know that video looked familiar to most of you, but it was so long ago. I wanted to be sure that we had an opportunity to refresh your memory on that. Um, I did keep the slide up for the email because again, I just want you to remember what this email looks like. All of you should receive this email this afternoon, and as said in the video, and as I said earlier, you will then just click on this link and it will take you through the process to get started. And then once you've got yourself set up with ID Pass, you can start the process for requesting access for your employees. Now, there is one clarification I do want to make, something that is different from the time that we recorded that video. And that is, I did say in the video, you know, you could choose to give them access to either the main iConnect, APD iConnect application or the EVV mobile site or both. We actually do need you to select both because they have to log into the main application at least one time to create their worker record. And you remember, and I'll show you when we go into the application, I'll show you what where the worker records are kept, but that worker record is only created by logging in successfully to APD iConnect. They have to have a worker record in order for you to complete the steps to assign them as EVV workers. For most of your employees, the role that you're going to choose is the service provider worker role. And again, I just want to stress one more time, I know I said it several times in the video, but it's very, very important that everybody remember you're only ever going to use your ID Pass account to request access for people who are your employees, no one outside your business, and they need access in order to do their job. If they don't need access to do their job, let's just say, for example, you do have administrative support staff that do different types of administrative tasks that are not in APD iConnect or maybe are not in APD iConnect yet, then they don't need to have access yet. Because if you give access to someone who doesn't need to have access or shouldn't have access, you could be setting yourself up as a provider for some very serious repercussions. Because again, what we're talking about is highly sensitive and confidential HIPAA related data. Also, as the agency owner, it's your responsibility to make sure that your employees understand they should never be sharing their login credentials with anyone else, because then they also are violating all of the HIPAA and confidentiality laws. So this is part of that, something you're going to want to start building into how your agency trains HIPAA and confidentiality for employees, because this is something they cannot share with anybody else. And again, once you go through those steps of requesting access for your employees, make sure that they know that that email is coming. Make sure that they know that it expires. You can use the handout that you have. It's got the the slide with the screenshot of what the email looks like so that they all know what to be on the lookout for, those kinds of things. So just make sure that everyone is aware of that information. Now, let me just look real quick. I know we've got a question in here. Will the passwords need to be changed every 45 days or so? And I will have to check with our security team on that because I'm not sure what the rules are for users outside of APD employees. I only know what the rule is for me as an APD employee. And so, yes, I do have to change my password, and I don't know the frequency. I just follow the prompt when I get the prompt to change my password. But I will get that information, and we'll make sure that we share that with all of our providers. And I think that's the only question that I've seen. But if you think of something else, please don't hesitate to type it in because we are hoping to have time for questions at the end.
Hey, Sheila, I noticed on the email sample that we provided that in addition to the actual email expiring in 5 days, there's some time frames built into when they click on the link. And I know with the first pilot group, we had some folks who received the email, they clicked on the link, but they didn't finish the process. And that caused a problem too.
And thanks for pointing that out because I actually did not see that. So Lynn's talking about this section right here. So again, when you get your email today, make sure you've got the time to finish the process. If you're inactive for more than 20 minutes, then you're going to be timed out. And then your registration process won't be completed. You'll also want to make sure that you share that with your employees. Thanks, Lynn. I appreciate you pointing that out. Okay, we have a question here. What is the process for staff changing a phone number, often for multi-factor authentication? So each of your employees, as they go through the process of completing their ID Pass registration, they will have the ability to set up and change their phone numbers as they need to. All right, let's go back to talking about what are you guys going to do once you get into APD iConnect. We talked about a lot of different things during your 5-day training, but today it's going to boil down to 3 primary things. For our solo providers, we want you to go in and add yourselves as EVV workers for all of the consumers you serve on your EVV scheduling tab. For our agency providers, after you've done the ID Pass registration and each of your employees have logged into APD iConnect and created their worker record, then you too are going to go through the EVV scheduling process and add your employees as EVV workers. You will likely also want to add yourself as one of those backup workers just to make sure that you're able to see consumers in the EVV mobile site as well. The other big thing that you're going to do during this pilot period is you're going to start adding your service logs. So as early as this afternoon, if you complete your ID Pass registration and you get logged into APD iConnect, you can begin adding service logs today. And I'm going to demonstrate how to do that. So, but you do also have the document that takes you step by step. And remember, in our e-learning library, we also recorded it as a video. So again, we want to make sure that however you process information best, we've got multiple ways that of presenting the same information for you. Also, for agency owners, because I know that one of the concerns has been, how do I train my staff? Because due to space limitations, the training has only been given to agency owners and solo providers. All of those videos and all of those documents that we have provided, you can then take that information and turn it around and give it to your staff. So the video and the document for how to create a service log, you can do that, and you can do it however works best for you. If your employees do well on their own and you can just give them the link and say, go to the e-learning library, watch the video, and let me know if you have questions. Or some providers, I think a lot of providers are going to choose to have maybe virtual meetings with their employees. And just like I just did with the multi-factor authentication video, show the video to the group and then ask questions afterwards so that the group understands. So work it however it works best for you and your agency, but you can start using those tools and building them into your regular staff training, new hire orientation, those kinds of things. The reason that you'll be starting to add your service logs in APD iConnect is because, again, as I said earlier, we're not rolling out the electronic visit verification for you just yet. And so, as you recall from your training, when electronic visit verification goes live for respite and then personal supports, and in the future, nursing provided in a non-licensed setting, the service logs will get entered directly into the EVV mobile site. But until then, we want you to practice using the provider documentation tab in the consumer's record to start adding those service logs. And then the last thing that you're going to do as a provider is check out your provider record and verify your information. Our regional staff have already gone through the records and verified the information, but I know if it were me, I would want to make sure that everything in my record is accurate. And if it's not, then reach out to your provider enrollment folks and say, hey, you guys never updated my email address when I got a new email, or remember our office moved down the street 3 suites. We need to update our address, those kinds of things. But again, We're fairly certain that the information's accurate, but I know you're going to want to lay eyes on it. If you get stuck, we've got you. We got your back. We have our APD iConnect support desk at 800-353-5168. Give those folks a call. They are happy to assist. They will help you with basic navigation and those types of things. But if they're not able to assist you, they will let you know, and they will go ahead and shoot your information over to the APD help desk. It's always helpful if you get stuck. If you can, take screenshots, because for those of us that troubleshoot with you, we need to see what you see. It helps us kind of follow that trail of breadcrumbs. So if you have a screenshot, that's helpful. Remember, for the most part, one of the first questions that anybody at either the iConnect support desk or the APD help desk, the questions they're going to start with are, what role are you using? What chapter are you in? And what page are you on in that chapter? So remember those navigational tips that we gave you during your training, because that's how we're best able to help you most efficiently if you do get stuck. And then I mentioned earlier that we want your feedback. We want to know what the experience is like for you. We want to be able to answer your questions. If you've got suggestions, we want to be able to add those with any other suggestions that we've received, so that we can make the implementation of APD iConnect for the providers the most positive and successful experience possible. So please send any comments, questions, any kind of feedback to iConnect at apdcares.org. Susan Appleton and I monitor that email inbox on a regular basis. And again, we're here to help you. If you get stuck and you're not sure, is this something that I call the help desk for, or you just want to send an email, go ahead and send the email. If I need to redirect you to the help desk, I'll do that. But if I can answer your question, I'll help you with that as well. So that is our introduction. What I'm going to do now, before we jump in with more questions, is I'm going to go ahead and go over into our, I'm using our testing site and not our training site today. And I knew I was going to get timed out. And I'm just going to walk you through those few things that we talked about in terms of what you'll be doing during your pilot period. So let me go ahead and get logged back in. And I'm going to use the provider EVV manager role. Remember, the default role you will probably have when you log in will be service provider for our agency owners and our solo providers. But you will also have a provider EVV manager role. For the things that you're going to want to do to start with, in terms of doing the assigning and the EVV workers, you're going to want the provider EVV manager role. So I'm in the site, and I'm going to go ahead and go into my demonstration provider record. Now remember, I'm in a test site, so that means that as a worker, I'm associated with multiple provider records. When you log into the live APD iConnect site, you're only going to be associated to your record. So you see here, I typed DEMO because my provider's name is Demonstration Provider. I'm that creative. You don't have to type anything in. You can type the first 3 letters of your agency name or your solo provider name. But because you're only associated with one record, you can simply click on providers and then hit go, and it's going to bring up only your record. So I just like to share that little tip because it makes navigation go a little bit faster, a little bit easier. So I did my search, and here's my provider, demonstration provider. Now, while I'm here, this is one of the things that you're going to want to do is just check out your information. Now, again, because I am using the provider EVV manager role, there are some tabs that we can't see. So you actually may want to use your service provider role to check things out, because that's where your worker tab will be. So actually, I apologize. Let me go ahead and switch to the service provider worker role, or the service provider role. The service provider worker doesn't have access at all. not to your provider record. All right. Now you can see there are a lot more tabs here with this role. The worker tab is the one that I've been talking a lot about. Once you log in the first time to APD iConnect and you access the workers tab, you're going to see your name. And then as your employees start logging in, you'll see additional names. So you're only going to see your name. And then the areas that you're going to want to check is just address, phone numbers, those kinds of things to make sure that that information is correct. You might want to double check to make sure that all of the services that you provide are listed, those kinds of things. And you remember all of that information. You have the provider training manual. You have all of the information about navigation that will walk you through what each one of these tabs are. So I just suggest that you go and spend a little time clicking around, seeing what's there, just to get comfortable with it. I will tell you that with our first pilot group, one of the things that I'm able to do, and everybody within APD is able to do, we're actually able to see where everybody goes and what they do. And I'll tell you, your counterparts in the first group, one of the first things that they all did, and I know you guys will too, is they all landed on that authorizations tab because they wanted to see all of their authorizations. Now, I'm not going to do that today because this actually is part of a real record, so there is some other information in there. So we're going to stay with the EVV scheduling types of activities. But yes, when you log in later today or first thing tomorrow morning, I know you're going to land on that authorization tab and you're going to want to take a look at what's there. And I encourage you to do that. But also check all of your other tabs and all of your other information that's in each one of those tabs just to make sure that your record is correct. If your record's not correct, feel free to reach out to either the iConnect support desk or to your provider enrollment team in your region, because they're the ones that actually make sure that the records are correct as well. So if there's anything missing or incorrect, start with them and they'll be happy to help you. Let me go ahead and switch back to our provider EVV manager role though. And the other tip is, if you haven't logged out and you change from one role to the other, when you click back into a chapter, it takes you to where you left off. So I didn't even have to type demo that time to get to the record. All right, so as a solo provider or an agency owner who's got employees that have logged in, one of the first things you're going to do is do the EVV scheduling. Going to come here on your EVV scheduling tab, and I have a filter for all of my demonstration records. And the first thing you're going to want to do is add primary EVV workers. So you can see from the grid right here where we don't have EVV workers. Some of the consumers have EVV workers. In your case, none of them will, because it'll be your first time logging in. So what you'll do is you'll go ahead and you'll pick a consumer, and you just check the checkbox at the end of the row. And then from there you go to File. Remember, File is your friend. And you choose Assign or Change EVV Worker. That's going to open a new little window for you where you're going to choose the type of worker. So in this case, you're going to want to choose the primary worker just to get started. For those of you who are with agencies, that's the person that, you know, if Susan is the one that always goes to Lynn's house or goes to Lynn's house 97% of the time, then I'm going to assign Susan as the primary worker for that consumer. So let's go ahead and, I believe in this case, I'm going to be assigning Lynn. Actually, I'll assign myself as the primary worker. The start date and the end date is how long the worker has access to that consumer. In the EVV mobile site, you actually can leave it blank because the access is driven by the authorization. So you see I've moved over here into the gray area behind the white screen, and it shows our service authorization start and end date. So right away, I can say, I can leave this blank, and I will have access as the primary EVV worker for the duration of the authorization. If an employee were to leave the agency and you needed to end their access, you could simply come here and change the end date. But remember, if an employee leaves your agency, the first thing you're going to do is go into ID Pass and deactivate their account altogether so they can't even get into APD iConnect. But you will, if you're going to need to assign a new worker, then you're going to want to pick a new start date for that worker, and you can do all of that here. So you can take an existing primary worker and change it to somebody else, or in this case, add a new primary worker for a new consumer. So you choose primary worker, choose the worker, and then you click update records. You get a box at the top, a long message that essentially is saying, are you sure? And the answer is yes, I'm sure this is who I want to be the primary worker. And you get another little message that says the record was updated. Screen refreshes, and now you can see my name is listed here as the primary worker. Now you saw there were also other options for alternates and backup workers. To do that, you do the exact same thing. Check on the box, go to File, Assign or Change EVV Worker. This time we'll assign a backup worker. It is important that you assign a backup worker because let's just say, for example, I have the stomach flu and I can't get out to see Albert today. So I call up Lynn and I say, hey, Lynn, are you going to be over in this area because I'm sick and someone's going to need to go in and take care of Albert. And Lynn says, yeah, sure, no problem. But if Lynn's not assigned to Albert as one of the workers, when Lynn logs into the EVV mobile site, she won't be able to see him. So for you as agency owners, you want to make sure that you've got all of your backups and your alternates set up, because otherwise, if somebody's out sick, they're going to have to call you as the agency owner, and you're going to need to then go in and assign somebody so that they can see that person in the EVV mobile site. So it's just more efficient to do it at the beginning if you know who all of the players are going to be. So I'm going to go ahead and assign Lynn as the backup for Albert, and I click Update Records, and OK the second time. And so when the screen refreshes, now you can see there's a plus sign here all the way to the left of Albert's row. And if I push the plus sign, I see that Lynn is listed as one of his other workers. So this is something that you'll want to do. I know that I saw a question scroll through a few seconds ago. For our solo providers, we know that you won't have a backup. And in those instances, the support coordinator should be working with you that if there's a need for an alternate provider to work as your backup, they have to make sure that there's an authorization for that provider. But we are aware that solos won't have to go through the additional steps of adding the backups or the alternates. Our agency workers, though, you're probably going to want to do that just to make sure that everything is covered in advance. So that is EVV scheduling. And you see it doesn't take long at all. The other thing that you can do is you can do more than one at a time. So I have two folks here that don't have a primary worker. I can check both of their boxes, and then I can go to File, Assign or Change EVV Worker. I can choose Primary, and I can assign myself, Update Records, click OK again. And voila, both of them were assigned at the same time. My name is showing for both of them. So this really won't take you long, and it is just something you have to do one time. As long as there's no employee turnover or change in assignments because somebody moved further, to a different part of the region, that kind of thing. This is something you shouldn't have to do very often. So that's the first thing you're going to do. And we want you to do this as quickly as possible, because that way, when we do roll out the electronic visit verification and the EVV mobile site, your agency or you as a solo provider will be ready to go. And then the other thing that we talked about, what we wanted you to do during this pilot period, is being able to add a service log. So for you as agency owners or solo providers, you can do that using the service provider role. For your employees, again, when you set them up in ID Pass, if they're an employee that doesn't need to have access to your provider record, then you're most likely going to just give them the service provider worker role. And again, as I said in the video, that role was designed specifically for employees of an agency that don't need to see the agency's business side of it. So for your respite workers and your personal supports workers and many of your other employees, they will probably just have that service provider worker role. All right, so let's go ahead and change to that role. And I'll take a few minutes and walk through how to add a service log. We're going to work with Alex, EVV Consumer, and his number is 22755. I have to write that down because I will forget. When I change the role, it will refresh my whole screen. And so now as the respite worker or the personal supports worker, I'm logging into APD iConnect today after I have provided services for Alex. So I can search for Alex by last name. I can search by social Medicaid ID if I know that. I can search by, iConnect ID, which thank goodness I wrote it down because I really would not have remembered. I can search by iConnect ID and click Go. And there he is, Alex EVV Consumer. I click on his name to open his record, and I have very few things as a service provider worker that I need to see in Alex's record in order to be able to do my job. For the most part, as a respite worker or personal supports worker, all I'm really ever going to do is come in to add my service log. Now, speaking of service logs, I do have to tell you that one of our most exciting things with the advent of our first pilot group is, as of this morning, there are 186 service logs in here. And that's from fewer than 60 solo providers that have been in here. They're adding service logs. The ones that have contacted us, they have said, once I got over my initial fear, because it's a little overwhelming to start, once I got over my initial fear and I started doing it, it's really not that hard. It makes my life so much simpler. So I know it looks different to you. Take a deep breath. It's really not going to be that difficult. And the other thing I do want to mention is that all of you will be receiving or maybe already did receive an invitation to join us for what we're referring to as a tips and tricks provider workshop webinar next week. And we're rolling that out for our pilot groups to just really kind of, again, give a little bit more support to you during this pilot period and talk about things that we've learned that have been helpful. Maybe some folks in the first pilot group will have some tips that'll help you in the second, and vice versa. So we just wanted to have an opportunity to share information. So again, be on the lookout for that invitation. But we're here as a service provider worker to add a service log. And we will do that on the provider documentation tab. So we click on the provider documentation tab and we go to File, Add Provider Documentation. And this screen probably looks familiar to you from your training. So the first thing that we're going to do is choose our date and time. And for our first pilot group, many of them went back and started adding in their service logs from October 1st forward. You can do it then, you can do it from the day that you log in moving forward. This is really just an opportunity for you to begin using the provider documentation tab to create your service logs. So let's say that I provided the service yesterday and I provided it at 1 o'clock in the afternoon. So I pick my start time, my end time, make sure my AMs and PMs match up, and I click add. Then what you're going to want to do, everything in APD iConnect is tied to the authorization. And the way to find the authorization is by looking for the auth ID. So you'll click on this search ellipsis right here, and that will open a new little window. And the first thing, and this is different because again, I'm in a test site, you're going to change that yours will be defaulted to your provider name. So I need to change this to my actual provider name that I'm in. And what you will do, it defaults to equal to, but you're actually going to want to change it to contains. And I'm actually working on getting it changed so that it defaults to contains. But if it shows up as equal to, change it to contains, and then you actually can also remove this top X. And when you remove that top X, it pulls up all of the authorizations that I have as demonstration provider for this consumer. Because remember, I'm in Alex's consumer record. So everything is related to Alex. I don't need to be able to pull him from a list of 30 consumers that I provide services for. I'm in his record, and because of our security features, everything in this record is all about Alex. So you can't go wrong. One of my little tips and tricks that I like to share is that while I can click on my name right here and it will bring certain information back into the screen behind the scenes, I like to click on this little plus sign at the end, because what it does is it exposes all of the services that I'm authorized to provide. Remember, in APD iConnect, and I know you guys can't tell because you've been getting the PDF copies of the authorizations, but once you come in, what you'll find is that each authorized service is actually tied to the same auth ID. So you see our auth ID here is 167489, but within this parent authorization, I have 2 authorized services, each with its own auth service ID. And this is where we get down to the level where the PA number actually is. So what I like to do is that, again, I like to push that little plus sign to see how many services I'm authorized for, but it also saves me some extra clicks later, and I like to save extra clicks. So if I click on the personal supports here, when I come back to the main provider documentation screen, it pulled in that auth ID, that parent auth ID, authorization ID. It pulled in my name as for the agency, and it pulled all that information about that service right here. Now, again, because this is a test site, there isn't a PA number, but when you go and do this in iConnect, there will be a PA number as well. So that one extra click for that plus sign saved me from having to click in all of these other fields and do other searches. That's why I like to do it. The other thing that happens here is because I'd already put in my minutes up here, my minutes converted to units when I brought over the service. And then we have our provider documentation type, which is driven by what the type of service is. In this case, it's personal supports, so it's a service log. You click on the service log and then you click the arrow to the right, and that's how we populate which it is. You can do multiples. You can, if it was something that was for all types of documentation, which would never happen, but you could move them all over at once or move them back. If it was something that had a progress note and a service log, like in the future when our nursing for non-licensed settings goes live, we'll be able to do progress note and service log, and you use the control key to highlight 2 different rows, and then you click the arrow and move them back. Or in today's example, it's just a service log. And then in this note field here, this holds 50,000 characters. And this is where you're going to type your handbook required service log documentation. So whatever it is that you currently are putting in your service logs, you're going to include that here. And then the only other thing is that when the note is finished and you're done with this record, you'll change the status from pending to complete. Now, because most of you are agencies, I know that a lot of agencies like to do QA of work before it's changed into a non-editable status, because once this becomes complete, it's then no longer editable. So that's one of the things that you may choose as an agency owner. You might say, Sheila, I want you to leave all of your service logs in pending status. I'm going to review them. If there's any corrections that need to be made, I'll get with you. And then when we both agree that it's ready, I'll be the one that changes it to complete status. And that's fine. That's totally up to you. As an agency owner, you can go ahead and make, grammatical changes, spelling corrections. Even though you weren't the person that delivered that service, you can do that. But I wouldn't suggest that you change the content of that service log, because if you weren't the person that actually delivered the service, then you're getting into that gray area of, well, you know what gray area I'm talking about. So again, once it's made complete, it's not editable again. Now, it's a new system. What if you change it to complete and you didn't mean to, and now it's not editable, and you like really forgot like 3 whole sentences that are important? That's okay. We can fix that for you. It will require you to contact the iConnect support desk and ask them to reverse the status. They will actually then forward that on over to our help desk team. But we can, if there's something that needs to be added to a note, we're able to go ahead and help you with that. So don't panic, because again, we know it's a new system and you're just following the list and you go, okay, I'm supposed to make it complete. Let me make it complete. And so you change it to complete and then you save it, and uh-oh, I forgot. So one other thing, this was something that we learned with our first pilot group. You can only have 1 service log per day. So you see here where we have the ability at the top to add more dates and times. And we had some folks in the first pilot group that were adding for the whole week. And so they would put in, 10:19, 10:18, and then today 10:19, and then tomorrow 10:20. You can't do that. It's 1 record per day. Now, if you have shifts, you can go ahead and put in the second shift. So let's just say, for example, yesterday I was in there from 1 to 2, but then I came back in the evening. So let's go ahead and switch back to yesterday. And I came back at 7 in the evening for the evening shift, because Alex went home. I stopped over in the afternoon to get him ready, but he actually went on a home visit. And then I came back and I was there for a couple of hours in the evening to help him with his hygiene activities, getting his stuff ready for his day tomorrow, those kinds of things. Then I can go ahead and click add. And I've got both for the same date. Both of them are for the 18th, 2 different times. Oh, hang on, let me delete that. That's what happens when your AMs and your PMs don't match. Let's try that one more time. Now we're gonna add it. There we go, we've got minutes. So they're both, this time I don't have the right date. 3rd time's the charm. So you see, mistakes happen. I do this all day, every day. I train this on a regular basis. Mistakes happen, they're fixable. Nothing to panic about. All right, both of them are the 18th, both of them are PM. We're gonna try adding one more time. We're gonna try adding one more time, she says, for the 3rd time, 4th time. There we go. 1, it changed our total of units. So it added all of those units together and changed that. But what you'll do if you've got morning and evening shifts or 2 shifts, then what you'll do is you will, in the morning, type in your morning shift service log data. And then in the evening, you'll type in your evening shift service log data. So it's all here in one place, but there's only 1 record per date. Today, I'll come in and create a whole new record for today's 2 shifts. And when we're done, put it in complete status, file, save and close provider documentation. And you can see it's right here. All of that information, all in one place. And here's the magic. Support coordinators are going to be able to see it the next time they log into Alex's record. They're going to see your service logs. So that is how to add a service log. Again, in our e-learning library, we've got the video of what I just did. You have the handout that walks you step by step through what I just did. We have the video for assigning EVV workers. And I believe the step-by-step is actually in your provider manual that you have from training. So we've given you all of the tools to be able to do this for yourself. And I think now we will just go ahead and start working through the questions. So Susan, if you could queue up questions for me, we will see what we've got.
Okay. While I do that, we do have several asking about EVV services for 24 hours. How many consumers can they add to a worker? Can they cover someone for 24 hours?
So let me make sure that I understand that question. So how many employees can they assign for the same
Correct.
consumer? So
Mm-hmm.
the maximum of that was the 5. And we will switch back to our provider EVV manager role just to demonstrate. And so remember, when you go to the EVV scheduling tab and you check the box and then go file, assign, change EVV worker, there are 5 total workers that can be assigned to any one consumer, whether it's a primary or an alternate 3. Next question.
Quite a few that you just answered. There are a lot of questions. They have 7 to 10 staff working with an individual. If they have more than 5, then what do they do?
I think part of it's going to depend upon how they're scheduled to work with that individual. They may have to come in and do some reassignments. If, let's just say, for example, and I'm going to make this scenario up, 5 is the maximum. And without being assigned as an EVV worker, you can't see the consumer in the EVV mobile site. So let's just say, for example, these 5 right here work with Susan Monday through Wednesday. And then there's 2 of them that stay with Susan and 3 others that work with Susan Thursday through Friday. You might have to come in and change those assignments if there are that many staff assigned to the same one person, because that's a max is 5. But let's not focus too much on when EVV goes live. I get it if you've got multiple staff that work with the same consumer now and you're wanting to do your assignments so that we're ready. But as we get ready to launch EVV and the EVV mobile site, we'll have another opportunity to come back and talk about some of those specifics. But unfortunately, with the system that we have, the maximum number of people that can be assigned is 5.
Okay. When a solo provider wants to assign a backup worker, how would they do that if the backup is not assigned to that solo provider as a worker? They're saying they have some agencies that are not agency providers, they are solo providers, so they would need a backup. How do they do that?
And I think I touched on this earlier. If you're a solo provider and there is a need for a backup, you have to work with a support coordinator, because they would actually need to create a plan service and an authorization for that other provider to be able to provide services.
Mhm. If a EVV worker also works for another agency, will they need 2 separate accounts, one for each agency?
Excellent question. And yes, because of the security that's associated with your login, if you have an employee that works for multiple agencies, than they have to have a login for every single agency that they work for. Because with one agency, they might have one role, and with another agency, they might have a completely different role. And so again, what people are able to see in APD iConnect is tied to their login and the roles associated with that login.
Okay, so when they send the email to the providers and it's a 5-day expiration, if it's not answered within the 5 days, can they have another one sent, and how do they do that?
They would have to contact the iConnect support desk. Lynn, for the pilot group, I'm sorry, Lynn, are we going to handle it through the support desk, or are we handling it through direct contact with email?
I think for this group, we're going to do the direct contact via email again.
Okay. So
And
that's
so,
just for you guys. That's not necessarily like for every provider in the future. In the future, it would be if someone let it expire and didn't get to it before it expired, they would have to contact the support desk. But because you're our pilot group and we want to make sure that we're able to get you in, you can go ahead and use that iConnect@apdcares.org email and let us know.
okay. For staff to reset their password, they will need smartphones or 2 phone numbers? And where do they put the second phone number?
So again, that's something that you can get more information on. So I do want to stress that we do have more documentation in our e-learning library. And I'm going to be honest, because I've not had to reset my password. I don't
Mhm.
know exactly where the second number goes. I think you put it in when you click the forgot password. I think it actually prompts you through that.
Okay. If 2 or more caregivers are providing services for a consumer in one day, different shifts, is it going to cause problems with recording the service log?
No, if they keep the service log in pending status, then the next worker can come in and finish up adding in the information for the second shift, and it will all go into the same note. So like I demonstrated on that one note just a few minutes ago, which is now in complete status, where I had it so that I was the same worker for the day, we could have 2 different workers come in and one create the 1 o'clock to 2 o'clock and a different worker create the 7 o'clock to the 9 o'clock. What you probably want to recommend to your staff is that if that's the case, that at the end of their documentation, they put their initials, and then the next person will put their initials at the end. But don't worry, because we actually have the ability to see who's been making changes to this record by looking at the history. So I'm able to see that I was the last one to update this record at 128:51 this afternoon. If there had been 2 different employees and multiple people, there would be a way to page through the different screenshots of what it looked like each time it was saved. So we also have the ability to see who's been making changes to any record created anywhere in APD iConnect. But my recommendation would be that if that's the scenario, then you tell the first employee, the morning shift person, leave that status in pending, and then the second shift person will be able to open it up and add their information to it.
Okay. Why are caregivers allowed to see the amounts?
That is just how the system is built, and the rates are public knowledge.
Okay. Can you upload your own document into a service log?
Not at this time, and I said it with a pause. There will be the ability for some providers who choose to use the external provider interface to directly import information from an existing system that they may have. Maybe it's a third party system, or they've created their own electronic health record system and they want to be able to export it from their existing system into APD iConnect. That's coming. But for this pilot period, we are asking that you go and have each of your employees directly enter the information in.
Okay. And this is kind of like that, but the end part is a little different. Will direct supports be able to see the rates? Can providers be the one to add the schedulers, add the schedules, and just have direct supports type in the notes? And then what if EVV times in and out doesn't match what is put into the schedule, into the provider documentation?
Okay, couple of things in that one. One, remember, and if you have not yet watched the self-paced webinar that's in the provider library for how to deliver an EVV service, please do that. And actually, let me just pull that up so you guys can see that. So in the provider library, we've got this how to use the APD iConnect EVV mobile site and deliver a service. And we've got the documents that go with it in terms of the step-by-step how to walk you through. If you've not done this yet, please do this, because at the end of the video, you have the ability to actually log into our training EVV site and deliver a service. Now, I will say that there are some folks that are having some challenges with that, and I think it's because of the high volume, because we are sharing logins so that it can be self-paced. So, Susan might be trying to log in with the same username that I'm trying to log in, that Lynn's trying to log in. And so sometimes you might get an error message that the account is locked and to contact your administrator. The document that we have here actually lists all of the different usernames you can try to log in under. So if the first one doesn't work, then I recommend you move actually to the end and work it backwards from the middle. And then the other thing is if you get that, if you've tried it maybe 2 or 3 times and you're still getting that, try changing your browser, because sometimes it works fine for me on all of the browsers, but sometimes if it's the first time you've ever used it, your browser might be feeling a little bit quirky, and that's because it's our training site. The full site, when we roll it out, has some additional configuration. So, and this is one of the other things where you might want to have a group meeting with your staff and do a group training and have them all watch the video together, have them all try to log in and deliver a service together. So the reason that I wanted to point that out is that when EVV goes live and you actually log into the EVV mobile site, you'll create the service log right there in the EVV mobile site, and it won't, let me say it differently. It will bring the exact date and time directly into the consumer's record. You won't have to come and add it a second time. When you upload that EVV activity, and I can give you an example, we're actually going to try this with the provider EVV manager role because you'll be able to see both. So again, because I use Alex as part of my demonstration, Alex has had some services delivered via EVV, and the way that we can tell that is in the provider record, using our provider EVV manager role, we're able to see all of the uploaded records for Alex, for all of the consumers. But we see Alex right here, he had one uploaded on 9/22 that started at 9:43. I can actually, using this role, I can go and look. Whoops, forgot to change it to consumer.
Mm-hmm.
I can go into Alex's record to provider documentation, and I can see that 9/22 record right here. So when I open this, this is an EVV record. The dates and times were created in the EVV mobile site. I didn't have to come back and add the service log. So when EVV goes live, we're going to pull you away from that provider documentation tab in the consumer's record. But right now, during your pilot period and before EVV goes live, we want you to come in and actually add the provider documentation record, add the service log. Susan, did I
Okay.
hit on everything in that question?
You did. The last piece was, what if the EVV time in and out doesn't match what's put in the schedule? I think maybe, say if I were at the consumer home and you know how I didn't end my time? So they would have the ability to change the time if it's incorrect.
Yes, if it's incorrect. The other thing to because I'm not 100% certain we're interpreting that statement correctly. When
Mm-hmm.
you do EVV scheduling, you're only assigning workers, you're not setting times.
Okay.
You're just making it so your employees can see Alex's name when they log into the EVV mobile site. So it's not like if Lynn and Susan and I are all assigned to Alex, and it's not like Lynn is assigned on Mondays and Tuesdays and I'm assigned
Mm-hmm.
on Wednesdays and Thursdays and so on. We're just all assigned so that we can access his record in the EVV mobile site. So it's okay if they end up delivering services out of what would be the normal schedule order for them, if that makes sense.
Mm-hmm. I think that was a good add. What is the difference between a service log and a progress note when adding documentation?
Those um, specific documentation types are defined by the handbook. So some services by the handbook require a service log. Other services require a progress note, and some services require both. And we do have the stipulation that if you deliver a service that the handbook requires both a service log and a progress note, that they can be the same document.
Now, this is, can you provide a range of approved ratios?
In terms of, let's just say, for example, you work with 3 consumers that have a 1-to-3 ratio. Yes, you can continue to deliver that service the way that you have always delivered that service. And the same way that you're doing right now on paper or in whatever system that you're using, you're still creating 3 different service logs for each one of those consumers because it has to be specific to the consumer. So if I'm working with Alex and John on a 1-to-2 ratio, I'm going to log into Alex's record and I'm going to create Alex's service log. And then I'm going to change from Alex's record to John's record, and I'm going to add John's service log, even if I serve them at the same time because they have a 1-to-2 ratio.
Okay. With iConnect being electronic, do they still have to keep paper copies for client reviews?
At this time, we are recommending that you still keep the paper copies for a couple of reasons. One, yes, for Clarent reviews. In the future, Clarent will be coming into APD iConnect and they'll actually be able to see everything here. One of the things that we are working on for our support coordinators and our providers is the ability to essentially export all of these documentation records into one report so that you could actually print them off and then give them to Clarent until Clarent comes in and starts accessing them directly. So yes, you are going to need them for that. For the support coordinators, however, if you're in APD iConnect and you're entering your documentation in APD iConnect, you don't have to send your documentation for these services, respite and personal supports. You don't have to send that to the support coordinators because they're going to be able to see it right here in APD iConnect. And we are contacting the support coordinators for the consumers to let them know who our pilot providers are.
Okay. You've already answered the question. There's a lot of concern about just the 5 workers being able to be attached to a consumer. It's a system constraint. There's really no other way around that right now.
That's
Will I
correct.
will iConnect interface with Therap?
As I mentioned a moment ago, there will be what we refer to as the external provider interface. And if you want more information about the external provider interface, I recommend that you come back to our provider library, scroll down to the video presentations. We've had 2 sessions already that are specific to the external provider interface. And we have another meeting scheduled this Friday, and providers are welcome to go ahead and register for that. We are asking if there are questions that you have about the external provider interface that were not answered in session 1 or session 2, to send us those questions in advance of Friday so that we can have the answers for you.
Okay, so let me make sure I give, because the question was answered, but this is, I'll make sure that I reread. The system, or restate, the system only allows 5 persons per consumer to be assigned right now. A person is saying it should be 10 minimum, but we don't have that ability at this moment.
That is correct. The way the system is configured, it is a system limitation, is that there are a maximum of 5 workers that can be assigned to any one consumer to be able to access in the EVV mobile site.
Okay. Are providers able to add a service log from a different date? How many days after the service they have to add the service log? I think we went over that one. You can add provider documentation, 1 date per provider documentation. You can do multiple times. The time period, provider documentation can be added for previous days, but it cannot be future dated. So you can keep your routine that you have now. If you record all of your documentation, in this instance, outside of the EVV mobile site on 1 day, you can do all of that sitting down in one sitting. However, the date will be 1 date per provider documentation.
Per record, that is correct.
Okay. I think when right is service log. And the same goes for the question posed. I'm not sure if it's a Mr. or Mrs. Gibson. The service log for the different shifts, they can be added in the one provider documentation because it's all on the same date. However, when it rolls over from the 18th to the 19th at 12:01, it becomes a different provider documentation.
Yeah, a different record. One of the
A
things that
different record.
yeah, it just helps if you start as a provider, if you start thinking about each one of these is a record. And so it's just one per calendar day.
Okay. This is good. Can we assign a specific staff on writing service logs in APD iConnect even though they didn't provide the service?
So I'm hesitating on that because, one, the person that creates the record really should be the person that delivered the service. They're the person that knows what happened. However, if it is your policy that you have your employees continue to do paper documentation and you have someone that's going to transcribe it verbatim, I would think, Lynn, that that's probably okay, correct?
Yes, but the key is that there's some documentation to support who actually rendered the service.
Right.
It would not be appropriate for your direct care provider to render the service and you go in and rewrite what actually happened because you weren't there when the service was delivered. So if you're going to have someone to go in there and enter that information into iConnect because you're concerned about the ability of your direct care staff to be able to do that appropriately, then you're going to have to maintain those hard copies that show the actual documentation that your direct care worker did.
Now, one of the things to keep in mind is that when EVV goes live, your direct care worker will be doing the documentation in the EVV mobile site. And so you may want to go ahead and start working with them to be able to do it here in the main application, because ultimately they're going to be doing it after they've delivered the service and closed out the record in the EVV mobile site. So that's just something to keep in mind.
Okay, Sheila, are there going to be any reports that administration can use to be able to mass review pending service logs or pending provider documentation?
There will be, and we are working on that right now because one, we know that providers need that ability to be able to just do some QA. And you're right, looking at this kind of line by line and opening it, that can be a bit cumbersome when you're a large provider and maybe you've got, 30, 40, 50 or more consumers. It just makes sense. So we are working on that. I don't have an ETA as to when that will be available though, but it is something that is currently being worked on.
Okay. When documenting time in and out for multiple caregivers, do they have to have a time space? So in other words, one clocks in from 9 to 3, the next worker clocks in at 3, or do they have to clock in like 3:01? Will there be overlapping, for that 3 o'clock time frame in this example? Is that okay?
Um, I actually will have to check that. I don't know off the top of my head if you can have one end at 3 and one start at 3. Actually, let's just try it now. Let's switch roles and we will see. Sometimes the best way to get the answer is to go ahead and give it a go. And I do see that we've got about 4 more minutes. So
Yes.
while I do this, if you could see if you've got any fresh questions that
Yeah.
we haven't touched on.
Does a
And if we
tablet
don't,
use for EV? I'm sorry.
go ahead. Go ahead. Go
We do
ahead.
have one. Does a tablet used for EVV services have to have a data plan in order to use GPS?
Yes, and we've gone over that with the training in terms of um, you have to have internet connectivity to be able to enable the GPS.
Okay, really there's only one other one. Can the EVV manager role see the amount for the authorizations?
Yes.
Okay. We've covered them all.
All right, let's see. I just did a 1 to 2 and a 2 to 3. And so it didn't tell me that I couldn't have overlapping times. So I believe that you'll be able to log in and out two different employees for a shift change at the same time.
Mhm.
Now, I know that we didn't get to all of the questions today. So for one, if you've got questions typed in that we didn't get to, then we will put the answers together and get them back to you. But if you didn't even get to get your question in yet, also then you can use that iConnect at apdcares.org email address and send those questions to me and we will get answers back out. Remember, your questions may have already been asked and they are in the FAQs. So please check the FAQs too, just to be sure, because again, those questions may have already been asked and we might have that information up. And with that, Lynn, do you have any closing remarks?
No, Sheila, I appreciate the information you shared today. I think, like I said, when we started, we learned some lessons from the first group, which I think probably benefits the second group in terms of providing additional information during the webinar. Just to say that this webinar is being recorded. And so we'll be able to get out information about how you can access the recording. After the point, just be on the lookout for the email that you will get later on this afternoon, and that will be your process to get your access to iConnect, and just follow the instructions very carefully in the email, including the time frames put in there. Don't, if you're out about doing services and you get the email, I would wait until you're back not delivering services and you have some time to carefully read it and follow the instructions. I think that'll probably reduce some frustration on your part to make sure that you get access easily. So that's all except good luck, and we appreciate your willingness to be a part of this pilot as well as to give us some much needed feedback we'll have going forward. So with that, Sheila, I'll say that's it.
All right. Thank you, everyone. You have a great afternoon, and we'll be talking to you.
All righty. Thank you.
Bye, everybody.
Bye.